Good morning. I'm Mark Richardson from the Lean Healthcare Academy, and welcome to the webinar on the 7 quality tools. I'll be presenting this morning, and just a little housekeeping before we start. You're all on listen-only mode because of the numbers of people on the recording on the webinar. You can have a chance to ask questions on the webinar, and I'll try and answer them at the end. Okay, the webinar will probably last about 25 minutes, and the recording will be available, and also the slides will be available at the end, and they'll be sent out to all the attendees. Okay, so the 7 quality tools. This guy here called Kaoru Ishikawa basically suggested that all employees have a greater role to play in any organisation, arguing that an over-reliance on a quality professional would limit the potential for improvement. And basically what he wanted was company-wide participation from the top management to the frontline staff, as every organisation can affect quality. All areas should study statistical techniques and implement them as required for internal and external quality audit programs. And basically he advocated the use of 7 basic visual tools of quality so that anybody in the company could analyse and interpret data. And we're going to go through each one of these in turn, just to give you an idea, some simple tools and methodologies. Okay, and they're basically tally charts, bar charts, histograms, run charts, control charts, Pareto diagrams, scatter diagrams, and cause and effects. Okay, so the first one of these is a tally chart. So important when you're actually starting your lean effort, plan, do, check, act, you need to understand what the baseline data is, and a lot of people embark on improvement programs without even doing simple baseline measures, and he advocated that one of the first things and most simple ways of measuring is using a tally chart, and it's probably the simplest, most powerful and underutilized improvement tool. So it can be used for things like telephone calls, number of interruptions, number of patients coming through the door, number of clients, number of service users. It gives you an instant measure and a snapshot of what's happening over time. To make this a little more sophisticated, a tally chart can be actually produced into a matrix of adverse events. So see these here is procedure cancellation reasons. So the number of cancellation reasons are listed down the left-hand side, and along the top is the surgeons. So looking at just doing a simple tally chart, why things were cancelled in theatres, and then looking at the surgeons that were involved, you can start to see patterns forming, and you can start to see where the biggest issues are. So even with quite complex areas, you can start to highlight areas of concern, highlight areas what I call directional indicators, where you can investigate further and find the reasons. Now, I'm not advocating this as a blame game. Surgeons 2 and 3 might have really valid reasons. They might have complex cases, comorbid cases that they are higher, but it gives you an indication of where issues are. Also, on the ward bed unavailable, that gives you an indication of where you might want to start looking for your improvement efforts. The next thing which he advocated as one of the quality tools is just showing data in simple bar charts. And basically, the graph on the left, the bar chart on the left, shows appointments day of week, and instantaneously anybody can interpret that Thursday is a lot quieter than Monday, for example. So doing it very simple and presenting data in a very simple way, one thing on one chart, can give you a very clear indicator of where things are occurring throughout the week, throughout the year with your patients and service users. One word of warning though, Excel, you can do lots and lots of nice coloured graphs, lots of bar charts, present lots of things on information, but it can start to get very complex. So my suggestion would be just to keep one thing on one graph, keep it very simple. You can make decisions and informed decisions just by using the most simple data. Histograms is basically a bar graph that shows frequency data. So linking in tally charts and bar charts, you can put tallies in and start to get a frequency or a distribution and come up with a histogram of data, very simple data. So this example shows adult weights, Okay, so the extremes and the outliers, but you can start to see where the averages occur or where the most occur. So this can help you inform as well about how you improve things or which areas you need to look at the most. Once you start to link them together, the distribution, you get a frequency histogram. And you can start to see here with these weights that you get in a normal distribution curve, where between 80 and 90 kilograms is the sort of most frequently occurring weight. Now the purpose of this is you can start to analyse your data, and here's a histogram of recorded theatre cut time up to 1 hour, and it shows a distribution of the times it takes. So along the bottom is time taken from the person coming into theatre to when they were actually operated on, ready to go. And you can see the most occurrences, about 300, occurred after about 15 minutes, and then it tails off up to 1 hour in some cases. But you can start to pick out patterns with your distribution, and you can start to pick out unusual occurrences. This example here shows a hedgehog distribution, and the hedgehog distribution says that the nearest 5-minute peaks have been rounded up. So this can be good or bad when analysing data, to pick out patterns to see if something's been recorded accurately. Okay, and in this case the actual time was rounded up and rounded down. Very useful for investigating data, and also you can also pick out things that may be dangerous. If you rounded up blood pressures in certain presentations, for example, that might not be very good. So you can pick out things like bad practice or even good practice or poor practice by just analysing your data. And you can see this quite clearly represented here. Okay, so distribution theory, why is this good? Why do you need to understand that? And typically, most walk-in services, accident and emergency services, I'd say healthcare services in general, form to a normal or natural distribution. So this could be the number of patients coming in per day, weights, heights, times of day, etc. And you will get an average. So the mean, that's a process centre, and you also can work out your standard deviation across. Now with standard deviation, this is useful because if you can work out one standard deviation around the mean, around 70% of the population will fall between one standard deviation around the mean. 95% will fall around 2 standard deviation, and 99.73% will fall around 3 standard deviation. And this is the basis of 6 sigma, where 6 standard deviation around the mean, you can understand 99.99999, etc. % of the population. Now this is useful in the fact that you haven't got whole data, you can start to model and predict what's coming into your service. A lot of services set up their resources and staffing levels for the average, and if you work out your staffing and resourcing levels to the average of the population coming in, then you're going to fail 50% of the time. So you can use the distribution theory and work out your normal distribution, rotate it through 90 degrees and come up with a statistical process control chart where you can work out your upper and lower control limits. This is good for understanding your process. It's good for understanding what's normal within your process. So say if you've got a normal distribution of numbers of people coming in, you've worked out 3 standard deviations, which is 99.7% of the time. This is the amount of people coming in. Okay, you turn it into an SPC chart, then you can understand, control, and also plan to manage the number of people coming in. So when you look at the upper control limits and the lower control limits, you would expect those numbers of people to come into your service. Okay. So run control chart, here's an example, and basically rules for a control chart. You have your upper and lower limits, you have a y-axis in intervals of time, usually per day or per week or per shift, and then you can start to look at your upper and lower control. You can work out your mean, you can work out 99.7% of the time what is expected to come through your service. Okay. With a run chart, the difference between a run chart and a control chart is a run chart is just a control chart without the upper and lower control limits, and that's useful for looking at trends and just looking at numbers that are coming in. Now a control chart takes that one step further and actually looks at your process and says whether it's in control or out of control. Now Mr. Ishikawa did mention things about stratification, and going back to the bar chart, stratification means just having one thing on one chart and not confusing things by having a number of data points, a number of parameters on one chart, and that's what it means by stratification. Okay, so here's a run chart example, and you can show the differences between knife to skin times. Again, going back to a theatre example, looking at one parameters 8:52 AM to the other parameters 9:28 AM for the same procedure. So you can start to see, is there any variation? Is it averages, looking at the times and looking at performance and seeing if there's any upwards or downward trends over data. Now a control chart, again here's an example where the average patients is 47, but like I said before, if you set your resources to manage 47 patients, half the time you'll be over-resourcing and half the time you'll be under-resourcing. You can work out your normal distribution and get your upper and lower controls, but it's very useful for working out the Erlangs or the 80% rule. And the Erlang from Kate Sylvester in the Osprey program is working out what resources you need to prevent queue growth. And the 80% rule is a recognized process for working out what is the optimum level of resources to manage the variation of walk-ins, the variation of queues, etc. Okay, so I'm only just touching on these. Apologies for any confusion. If you've got any questions after, please ask, or please send an email to me and we can go into this in a bit more detail to explain Erlang's rule. But building on the 7 quality tools, these are tools that can enable you to look, plan, understand and manage your process or your service going forward. So they're very useful. Okay, so it enables you to pick out variation. So once you've worked out your upper and lower controls, you'll have a natural variation. And basically, if nothing changes, the process should sit within its limits, 99.7% of the time. But you can also get special cause variation, and run and control charts can help you understand and manage and plan for that. So what do we mean by special cause? It's what happens when something changes, when demand increases, i.e., if a celebrity gets an illness, you tend to get a bigger demand on the service. Basically, winter pressures, you can start to see trends there. Heat waves, when public holidays, okay, some of these are predictable, like Christmas comes every year, it's very predictable. Some are not, things like unexpected snowstorms, and these can cause special cause variation. This allows you to get a heads up basically about changes as soon as it happens, so you can plan and manage so it doesn't come as a total surprise to you. Okay, so here's a big warning. I like our big warnings in Lean, but basically you need to understand how you gather data and be fully familiar with the system and processes being examined and how the data is being collected. So with the 7 quality tools, how people gather data is important. Everybody must gather the data the same way. Do they go to the same decimal point? Are they rounding up, as noticed by the hedgehog example? Are they measuring height with shoes on or off? Are they including breaks, etc.? These things are important to make sure that you take away that unnatural variation and make sure everybody's gathering the data. Also, things can happen. People default. I've done some data analysis when you're looking at 4-hour targets. People just put 4 hours in, but they had been seen well within the 4 hours, but they just default. So if you want to understand the process and get the real true measure of a process, you need to make sure that people are collecting data accurately, consistently. And in Six Sigma, there's a whole science around gauge reproducibility and repeatability about gathering data. Okay, another useful tool, and this is very useful in conjunction with a control chart about the numbers coming in, is a Pareto chart. And basically it's come from a guy, an Italian economist called Pareto, who recognised that 80% of the wealth is owned by 20% of the people. I'd probably say that 99% of the wealth is owned by 1% of the people nowadays, but it was a recognised process that looking at any process, you'll find that 80% of your work comes from 20% of your customers. And if you look at this example from referring PCTs here, shows done a while ago, that the top 4 PCTs there provide 84% of the referrals. So if you're doing improvement work, you'd focus on those 4 areas because you might have hundreds of GP practices in your area. If you focus on those 4 groups, then that would give you 84% of the improvement effort. Because what you find is a long tail of small, complex, little areas that give you 1 or 2%, but cumulatively they add up. But for 84% improvement, you'd just focus on those areas. It's useful as well if you're looking at presentations, so in conjunction with A&E, you'll look at numbers coming through the door, and you could do a Pareto on the types of presentations. Pediatrics, this is quite marked because probably at least 30% of them will be respiratory problems. Okay, we found things like 50% of patients attending are under 3, probably getting up to 60-70% are under 5 years of age. So it can help you make decisions on where you focus improvements, things like even the practical aspects, how many cots as opposed to beds that you need. So very, very useful in looking at your data. And I would argue that these 2 things simply, and talking very simply, by having a control chart and a Pareto chart of the types of presentations and the types of the numbers of people coming into your service, you'll be able to have a good go at managing your service and predicting any changes going forward. Okay, here's where Pareto's helped. This one was Bradford Teaching Hospitals, and Pareto's was done with the senior consultants in hematology and oncology, and basically they came up with guidance for routine blood tests. What they were finding were there was a bit of belt and braces going on, and people were just requesting a group and save or a full blood test on everybody that came in, and the hematology lab was really struggling. So basically they came up, looked at the Pareto, what the most common types, what the presentations and what types of blood tests is required, came up with some simple guidance on an A4 sheet and reduced the demand on the lab by like 17,000 tests over a period. Okay, so quite powerful. So, just using simple Pareto enabled the right thing at the right time, speed of response, and also more efficiency, saved money. Okay, scatter diagrams is another one of the quality tools, and it can show interrelationships between 2 sets of variables. This example shows here data referral versus date seen in clinic, and this was a TIA service. And basically before the improvement, you can see there was a lot of variation between date of referral and date seen in clinic. Once the standard operating procedures have been put in place, you can see a nice linear progression, a nice relationship between the 2 dates. So you can demonstrate quite clearly that you've made an improvement. Very useful, very powerful tool, and you can start to predict, even if you've not got very much data, linear progressions. Okay, Mr. Ishikawa also came up with a an example for problem solving, so enabled staff to look at areas and problem solving. He came up with the Fishbone diagram, or known as an Ishikawa diagram, named after Mr. Ishikawa. And basically a Fishbone diagram builds on brainstorming, but it categorizes it into 5 sort of key areas, whereas in the environment, and that's a work environment, people, policy, equipment or procedures. And it helps you to spot clusters. So here's an example. I've got a very simple example. Bread is too difficult to cut, and there's a number of reasons why that could be. Could be people problem, person too weak or didn't understand how to do it. Bread is too stale, exposed to wear. The equipment, storage not suitable, knife not sharp enough, etc. And it helps to show clusters of where the potential problems can be. Useful to build onto brainstorming and give it more structure and help to support that. Okay, so alternative tools, business process maps and process flow mapping was a recognized tool, and sometimes when you look for the 7 quality tools, they'll replace 1 or 2 of the other tools with process flow mapping. But business process maps are a very visual tool, again, to understand the process, and it's great to see who. If you look down the left-hand side, those are the players, those are the people that are involved in the process and the different colours. What they do, those are the individual boxes. So you can see the patient is involved 4 times in the process, touch points at those particular times, and also when. The little dashed lines down the bottom are sort of phases. So initial testing between up to 42 days, referrals up to 21 days, testing. So you can see at a glance who does what and when quite easily on a very clear sheet. When I was working in a chemical factory many years ago, we used to use these for coma. It was a coma top tier site, very highly regulated, and all our emergency procedures were put onto this format, and British Standards Institute loved them because they were very clear, very direct, and especially in high hazardous situations and escalation procedures, you could see who, what and when was responsible and what needed to happen in a very clear format. Okay, so there's the 7 quality tools, but basically in action, views on this is a pediatric study here, and basically looking at a number of pathways using process flow mapping, looking at Pareto diagrams, looking at ages of people coming through, looking at simple bar charts, and looking at the tack time there, the red line, so what they could actually manage per day, but looking at the variation, looking at again emergency and elective admissions and coming up with a control and FPC chart. So using a number of the quality tools, they actually enabled the information and decisions around the moving to a new hospital unit, and basically it came up with a sustained reduction of 6 inpatient beds and 8 day case beds. It demonstrated seasonality, so they could flex staff to meet peak demand. Basically day case scheduling was moved slightly, so it was improved day case scheduling over the working week, and despite an increase in demand, length of stay is reduced as well over a time period. So just by looking, process mapping, understanding the processes, doing some simple data analysis on the demand on the services, it enabled to make them improvements in that paediatric department at a time of a major move. So it's very, very useful understanding your baseline data, because that can help you inform decisions and make changes in a very simple way. So basically Mr. Ishikawa, there's some quotes from Mr. Ishikawa, and basically quality control starts and ends with training. He's very keen on quality control, leading to quality assurance, and basically he's saying quality control is applicable to any kind of enterprise. Okay, it must be applied in any enterprise, and basically control and improvement are confused. Quality control and quality improvement are inseparable, and if you're doing any type of improvement, you need to define your problem and your target where you want to be. You need to measure, and this is very key, and there's lots of sophisticated tools out there, but if you understand the basics, understand the simple information, you can actually start to manage it. Once you start to manage it, you can start to improve it. Okay, so understanding Ishikawa's philosophy means that quality control is not just a company's internal quality control activities, but the company itself and the quality of its management. Also not forgetting, because of the Toyota, a lot of lean is around human respect, making sure that people are respected to understand the process, make changes to the process, and actually the benefit of customer care, and give lots of benefits such as reduced defects, increased reliability, increased quality of what you do. You can identify waste and reduce waste. You can start to build this as a basis of your improvement techniques. You don't have to inspect after the event, so it's moving towards quality assurance, instead of insurance. You improve your reputation, you improve communication. Okay, you reduce the amount of false and inaccurate data, and it's a generalization, I know, but the NHS is very data rich but information poor. Okay, you can focus more on your meetings and they're more effective, and you can improve human relations. And it's just those simple things, and that's why you did it, but it really works. And as you can see from the example on the previous slide, just by understanding, analysing the simplest things can help you make sustained changes. Okay, thank you very much. So this was a brief introduction to the 7 quality tools, how useful it can be. As I said before, if you've got any questions, I'll stay online. Unfortunately, I can't answer questions live, but I can answer them through the chat function at the bottom of the screen. Also, if you don't get a chance or you think of anything after, if you just let Jay know, she can pass on the details to myself and we'll get back to you. A recording of this webinar will be available after, and also we'll send out the slides on PDF as soon as the webinar's finished to all those that attended. So thank you very much for your time, and I'll stay online for another 10 or 15 minutes or so answering any questions. Thank you.